Okay, welcome again to this platform. Today we are dealing with uh, complication of traumas in mental health and how they can be managed. Now, before we go to complication of traumas, there are some important information we need to know so that no one can be confused on what we are going to discuss next. We are here, we should discuss about the types of trauma that we should look at because trauma is a wide word and it may relate to several things that we may be confused about. We go to, if you're coming in right now, I've just started, and as it says, we are dealing with traumas and related issues. Ready M. Yes, welcome to the platform. Mary Butler Britton, welcome to the platform. Today we are discussing types of trauma. Types of trauma. As per last time, we saw we associated the topic with so many issues. So today is trauma-related disorders. Trauma-related disorders, but we need to understand that to know which type of traumas are we talking about. So here we're gonna talk about several issues and define what kind of traumas are we going to talk about. We start by saying in mental health, trauma refers to an emotional response to deep distressing, disturbing event. You should understand that clearly. Trauma refers to emotional response to a deeply distressing or disturbing event. Trauma can be classified in several ways depending on its nature, duration, the source of the trauma, and impact of the trauma. You get that? Those are key important issues when it comes to trauma: the nature, the duration, the source, and the impact of it to you, personal, or to a person who is a relative, a friend, or someone who is around you. Below, there are several types of trauma when it comes to mental health. Now, they are categorized like this. Or I repeat, okay? Let me repeat it. Trauma refers to an emotional response to a deeply distressing or disturbing event. It can be classified as nature on its nature, duration, source, and impact. The main types of trauma that we are talking about today are these. These are the categories of trauma that we are going to talk about. Acute trauma, one, that is acute trauma. We have chronic trauma. Chronic is the trauma that has stayed for so long. The types of acute trauma that we know are like a serious road accident, Dream Island. Yes, welcome to the platform. We are dealing with trauma today. Traumas. We're gonna know how to manage different types of trauma when it comes to mental health. Yes, so we are categorizing them as acute trauma, chronic trauma, complex trauma, developmental trauma, yes, and secondary trauma. Secondary trauma is sometimes called as vicious trauma, and we have historical integrational trauma. You understand that? Bless up, bless up, bless up so much. Welcome to the platform. Now, Dream TV, historical integrational trauma. You understand that, and then we have collective trauma, collective trauma. We have medical trauma, emotional and psychological trauma, which is so bad. Emotional and psychological trauma. So, as I do an overview, let's go to the first one, which is acute. Acute trauma. Acute trauma. This one results from a single distressing event. Single distressing event. You understand an event like an accident, someone has just passed on, a loved one, physical or sexual assault. Those are acute traumas, a distressing single event. But we have chronic traumas. These ones are prolonged traumas, traumas that before you deal with them, they take some time. You see, things like domestic violence, they take time to heal and take care of. Those are chronic. Long term child abuse, wars, uh, pandemics, pandemics like the COVID 19. That one was a long time, and some people are still facing effects till now. We go to the second one. I'm just uh, going deep into these types of trauma as we explain the traumas that we are going to talk about. Hmm? Complex traumas. Definition is exposure to multiple variable traumatic events. You are always being exposed to for explaining so clearly, Jamaica. Yes, Mary Bolter, thank you so much for your response. Thanks again. I am going so slow so that everyone can relate and know how to handle traumas wherever every person is. There are some people who don't know how to handle traumas. Today we are going to talk about how to handle traumas, including palliative medical care, because you see palliative medical care is trauma both to a person who is suffering plus the family or the guardians around that person. Yes, we are at the third one. Yes. Definition is complex trauma. Complex trauma, we have said, is exposure to multiple variable traumatic events, often of an interpersonal nature, typically during childhood. You get it? Complex trauma. You are exposed to very funny events when you're a child, and then it comes out in your adulthood. You see, examples are neglect, abuse, and abandonment. Yes, hit the like button. Very important. Yes. Institutional trauma, long term foster care with frequent moves. Foster cares, you are living where you don't want to live. That is complex trauma. But in complex trauma, we have seen these are several events carried about from the childhood that are going up to adulthood. So when we start discussing, please get to understand how to differentiate them. That's why I'm going so slow. Okay, we have developmental trauma, traumas that occur in childhood, traumas that these ones are in childhood and they disrupt normal development. Hmm? Emotional neglect, emotional traumas in childhood, caregivers addiction or mental illness. Caregivers addiction, parents and guardians, alcoholic, and sometimes that are addicted to substance, development trauma. These ones are inverse. They are directly to the kids, not to the person who is addicted. Inconsistent attachment. Inconsistent attachment. You understand what I'm talking about. The fifth one, which is secondary trauma, we said secondary trauma at times is called vicious trauma. Vicious trauma, symptoms that develop direct, indirect exposure. Sorry for the flu. To traumatic experience. Vicious exposure to traumatic experience. You get it? Like, let me say, therapist or first respond to absorb. Yes, Judy, Big Sis, I see you are in the platform today. Yes, you're talking about traumas, types of traumas and traumas related issues. You see, as a therapist, this one happens a lot. The secondary trauma happens a lot to people who are taking care of the patients. You check it. You as a therapist, You are absorbing the trauma. The clients are coming telling you about what they are undergoing, and then you go home absorbing it, and you be part of the problem. Even medics that are in the platform, this is very important to you. You really need to know how to absorb and take care of these traumas, because you may find that you are the one who is undergoing the traumas instead of the patients who are coming for you for help. We are going to talk about how to handle that. Journalists, imagine journalists are going on the field, and then they are being exposed to live coverage of violent events. Yes, Sana, welcome to the platform. Thank you so much. I can see you. We're talking about traumas. Hmm? Journalists covering live events. Big up Maureen in the platform. Yes, I can see Maureen Chege. That one is from Kenya. Good, Sana. Well, I can see Lady M, Judy Moyo, and then Maria. Yes, people all over the world are here, and we are discussing on how to help people mentally. Yes, I was talking about mental health. Now, journalists, when they are covering live coverages, they encounter several things: dead people, injured people, like in wars. The kind of trauma they carry to their home, it needs a therapist. So you see, this is vicious trauma complications, and we should know how to handle this. And then we got the sixth one, which is historical integrational trauma. Historical integrational trauma. Hmm? Trauma passed down through generations. Yeah. Often tied to cultural oppressions, colonizations, and slavery. When someone sees a white man, because of the stories that the grandfather has given to, it becomes traumatic. Dealing with another race becomes traumatic because of the experiences and the stories that this person has been told. Hmm? Indigenous population affected by colonizations. This has happened and everyone knows. If you go to other countries, you'll see some places like in Africa, South Africa, we had something called segregation, apartheid. Those traumas are still going on up to now. Greetings, Benjamin, and everyone. Yes, welcome, Johnny B. We are talking about trauma today. Descents or Holocaust survivors. This is integrational traumas of historical line. Collective traumas. Number 7, trauma experienced by a group of people or community due to a shared event. Yes, earthquakes, tsunamis. Remember the tsunami in Japan? It is still hunting people even now. Terrorist attack or genocide. I'll give an example of Kenya, where there was a bomb blast attack. Some people are still having the trauma even now. Pandemic. When we talk of pandemic, everyone thinks of COVID-19. Very bad. Medical trauma. Trauma related to, yes, if we continue, today is 5:30. Yes, we continue while asking questions. We collectively answer and share the experiences so that we can save time. Today, if you have a question, post it on the platform so that we can deal with it. Now, number 8, medical traumas. Those ones we know. Medical traumas are severe illnesses, injuries, or medical procedures, traumas, prolonged ICU stay. Sometimes they end up to brain death. Cancer treatments. You've nursed someone with cancer as a doctor, and then you get traumatized. As a family member, you get traumatized. We really need to know and understand the procedures of palliative management in this. You get it? So that you cannot end up having trauma issues after treatment. You get it? Emotional or psychological trauma, verbal abuse, bullying, betrayal in trusted relationship. I think this is the one that I'll start with: emotional and psychological, and psychological trauma, because this one is the most one that is always disturbing everyone. Emotional and psychological trauma. Let me tell you one thing. If someone abuses you emotionally, you will not take a painkiller to relieve the pain. You get it, Dorothy? Come. You will not give a paracetamol to relieve the pain. You see, add Buscopan 40 to her. It's okay. Add emotional. You see, if someone abuses you emotionally, the trauma that is in you cannot be killed by a painkiller. So it is of good understanding that if once you've passed through this, or you are undergoing this, yes, you see, someone is saying on the platform, I faced the COVID-19 pandemic. I was traumatized. I lost my sister and her daughter and many colleagues at healthcare department. Now, we are here to help people to know how to deal with such kind. Sana, we are sorry about it. Today we will know how to handle. I know it was some times ago, but time passes, and as we scientists uh, talk about some issues, we know God is our healer, and God has all the plans, and He knows what He was doing. Just a minute. Yes. So we will know how to deal with. Let's start with the emotional or psychological trauma. Emotional and psychological trauma. Hmm? You get it? Emotional and psychological trauma. Emotion or psychological trauma is a response to a deep, distressing, or disturbing event that overwhelms an individual ability to cope. Let me repeat that line. Is a response to a deep, distressing, or disturbing event that overwhelms an individual ability to cope. You get it? It may result in feeling of helplessness, diminished self-worth, and difficulty regulating emotions. The response to a deep, distressing, or disturbing event that overwhelms an individual ability to cope may result to a diminished self-worth, difficult regulating emotions, and common causes are acute trauma, a single overwhelming event we have talked about, like car accident, natural disaster, physical assault, witnessing a violence. Sometimes when you witness a violence, it becomes emotional traumatizing. Chronic trauma, repeated bullying, domestic violence. Domestic violence is not a good thing. Hmm? It's not a good thing. And at times, when people say you can stay in a relationship and talk out things, and there is emotional violence, not even physical, I think at times it's better to separate ways, talk things when we are separate, so that someone searches him or herself before this person knows what next to do. Because emotional trauma, it can end in a deadly bit of death. You get it? Those chronic traumas like child abuse, war, long time illnesses are not good. Complex traumas, like again repeated abuse, child neglect, human trafficking, and attached disruptions, they are not good. So, what are the symptoms of a person having this emotional trauma? Symptoms are like this. Sometimes when you look at a child or a person, this person has attacks panic attacks, and anxiety. We talked about anxiety, it's very important. Sometimes you may find that this person has depression, and knowing that a person has depression, you will see that this person withdraws from society, wants to stay by him or herself, or the negative, anxiety. Yes, Sana, anxiety. We talked about anxiety and the symptoms of anxiety. Now, depression can be positive or negative. Withdrawal, stays mum, not talking to anyone, or the opposite, whereby this person is so loud, raising storms over teacups. Any simple thing, this person shouts out and talks out loud. That is a positive reaction when a person has depression. Mood swings or irritability. These are symptoms of traumas. Irritability. You've seen people that have grown with traumatizing events, they are always irritable. Let me say, when a child is born in a society whereby the guardians that this person is living with are always so harsh to this person. When this person grows up, he'll be irritable. He'll be any small thing this person is irritated with. And this will not be the problem of the current situation. This is a problem that was carried out from the childhood. You get it? Emotional numbness or detachment. Sometimes you are detached from emotions. You don't want to be attached to any person emotionally. Hmm? Sometimes when you meet these people that wants to stay alone, saying they are introverts, always staying at home, find out the problem behind the detachment from the society. You will see there is another story behind that may lead to this person living like that. And mentally, it is really affecting these people. Most of the people that you see they are calling themselves, I'm an introvert, I need to stay alone. After that, sometimes you will find some funny stories that come out. Hmm? Or most of them cut weight a lot. You get it? That one is emotional damage, trauma that was carried alone that is affecting you physically. And as per the talks we had previously about the neurotransmitters, you'll find that these people have low neurotransmitters in the brain, like serotonin and dopa, and the other one, which is norepinephrine, even acetylcholine. If this if these neurotransmitters in brain drops down because you are traumatized and always in depression, what happens? You start deteriorating physically. Hmm? Cherono is in the house. Cherono, welcome. Welcome to the platform. Now, flashback and intrusive thoughts. You'll sit with the person, and this person will start telling you something that passed away so many years. Hmm? Nightmares. We talked about nightmares. Please, if you have not gone through the other videos, it's very important you go through the other videos so that you know what is physical symptoms. Those ones were emotional. You will have insomnia, disrupted sleep, always fatigued, headaches and muscle tension, gastrointestinal problem, nausea, IBS, startle response. You are always having a startle response. Behavioral symptoms, avoidance or reminders, substance abuse. You see now these are positive physically. These are positive response to traumas. A person had traumatizing events sometimes, like you are living with a person who is always insulting you. Insult to kids is not a good thing. No matter what a kid has done, it is not good to be telling that kid you are stupid at a tender age. This tender age is writing a book under the brain that will be carried in future and it will explode. You know, whatever you cook is whatever you you serve. So a kid is something that is being cooked at an early age. So when this kid is is young, you keep insulting this kid or child abusers. It is a book which is being written that will explode in future. Hmm? You see, the behaviors that will come out are like these ones: avoidance of reminders. Don't want to be reminded about some things. The person may be dipped into alcohol. Just as I said, someone cannot just start abusing substance and alcohol every time. There must be something that this person is hiding behind, some traumatizing events or psychological breakdowns that this person is hiding behind this substance or alcohol. Poverty may be one of them. Some some things like in marriages, there are so many things that undergo. So instead of this person handling them directly, this person hides in alcohol or a substance. At times, it's good to go and say the truth in front of anyone so that you can get away and get help. But when you are in a relationship or a love affair, or you are in a family relationship with your brothers, hiding in alcohol instead of talking out whatever you want to talk out so that people can know your problem and start handling it, it might not be good. You see, sometimes you may find some people wanting to commit suicide or harm themselves. So, social withdrawal, getting away from the society and being alone. You get it? Change in eating or sleeping patterns. It's not good. Hmm? But you see, these are things that have come out over long years of time that needs to be handled because they are chronic issues. You see, we have here something called cognitive symptoms. Cognitive symptoms are symptoms that the brain transmit, like poor concentration, memory problems, negative beliefs about self or worth. You get it? Yes, Sana, that is a very good question. Bipolar is a brain related complication, Sana, and we talked about bipolar and we saw it is it is a hypothesis, it is not confirmed, but it is said that neurotransmitters like serotonin and the front and the midbrain, like the dopa levodopa, those are related to bipolar complications. Please go to the video that we talked about bipolar complications. They are so it's so important. You will understand the the differences between bipolar complications and traumatizing events. But you see, you may confuse again between bipolar and traumatizing events that lead to future complications. So, chronic trauma can lead to depression, and depression can lead to a bipolar condition that is not long term but short term. So, it's very important to differentiate between those two because depression, the first one, which is the mania has its qualities. So, if you want to understand as we go on, please go back to the bipolar complication and the depressive disorders, you will understand. Now, cognitive symptoms when it comes to this topic of ours, which is emotional or psychological trauma, are memory problems. Sometimes you forget easily. Negative beliefs or self of what? Hypervigilance. Hmm? Hypervigilance is a problem. Hmm? Now we go to, if you have a question like Sana, you just ask. It is very important. And then we have another thing called risk factors. Risk factors is like who are at risk to get these problems. We have prior history of trauma, a person who had a history of trauma, the traumas that we have talked about, lack of social support. You are around people who are not supporting you, and just a minute, guys, I'll be back. Sorry about that, guys. Sorry. Now we have genetic or biological vulnerability. Genetic or biological vulnerability. Sana has asked about bipolar disorder. Genetically, some families are prone to this. We saw the gene type that can come out with the genetic problems when it comes to brain disruptions. Trisomies are gene mediated complications of human. Yes. Like Down syndrome. You see, child adversities, pre-existing mental health condition like psychosis. We talked about psychosis. You see, these are the risk factors because when a person is psychotic, the traumatizing event is both ways. The person himself and the family members and the others. You get it? Now, we go to the other long-term effects in if not addressed. PTSD. We're going to talk about PTSD today, post-traumatic stress disorder. This thing destroys people so much. Anxiety disorders. We talked about anxiety disorders. Depression. Depression, we talked about it. The main one being mania. The mania. We talked about it. Borderline personality disorder in some chronic trauma. We talked about it. Relationship difficulties. Yes, it's very hard to maintain relationships when a person is traumatized. A young lady who has been traumatized or a young boy who has been traumatized through his life or her life meets a young girl or a boy, but the young person displays characters of trauma in this way. Solving issues becomes a problem because this person believes that, let me put it clear in this way, a father who has been beating a mother, insulting emotionally, and treating this parent badly in front of the kid. The kid comes to be married afterwards, traumatized. It will be so hard for this kid to understand that a marriage can live without fighting and solving issues. This person will be always irritable. So if this person meets a person who doesn't understand how to deal with issues, it will be so hard for this marriage to thrive because they'll be fighting always. This other person will not be listening to the other person. This is where psychological counseling comes in. But if it is trauma related like post traumatic stress disorder, now this one needs a psychiatrist. If there are medication to be induced, to start medication. You understand? Now there are some things like anxiety disorders. When you live with a person with anxiety disorders, it will be so you might find several problems in the relationship, be it a sister or brother or a mother. These ones are long-term effects that come out when you have a person who is traumatized. We have substance use disorders, long-term effects. Some people use substance for long because they want to get away from something, hiding in that thing. So the next time you find someone is an alcoholic or using substance or a kleptomaniac, I say, because kleptomania is another way to show that there was some childhood traumas before. Find out what happened Don't say this person has a problem. Yes, this person has a problem that you can solve, but find out, let this person open up. And you see, long term traumas can come with prolonged chronic issues like diabetes. We saw how diabetes comes in. Insulin resistance because of low and dopa serotonin in the brain. And then you start having high sugar levels. Hypertension, part of it, comes because of depression. You see, due to prolonged stress, chronic issues. So, how can we manage these problems? How can we manage these problems? Initialize, we go slowly by slowly when we are talking about emotional or psychological trauma. How to manage emotional or psychological trauma. The first phase is initialize stability. Safety first. Remove individual from danger if trauma is ongoing. If you find that a person has been depressed, secondary to the traumas that he lived some times ago, you remove this person from the scene. If this is a marriage that is not good, or the traumas of before are coming in to the present, if you have a wife or you are married, or you have a husband, that you are seeing this husband is doing some things that you feel there is a problem, and it may bring problems to the family. Problems to the family means this: one, the kids are adapting the behavior; two, there can be physical injury; three, there can be emotional damage. Very clear, because now a marriage means children are there looking on what is going on. What is there is to remove individual from danger if trauma is ongoing. So one of you should be aside first. You get it? That is very important. Saving life is very important, and protecting the children's life is very important, because we don't want to carry children that are traumatized because of adults. Or if a person is depressed, this is not a married person, and is in an environment that we can be of a health risk, living alone, traumatized. This person is not eating, does not want to go to job, he doesn't take shower. Find refuge for this person where he can be monitored. You understand? Very important. This is a very important issue when it comes to physical injury and emotional support. We go to the second step. This is, we are still in the initial stabilization, the early phase of trauma management. We have removed the person from the problem. We are monitoring. The husband is fighting with the wife always because there is another third party in there, and the husband does not want to say. The woman has realized. We don't want kids to see what is happening. We don't want kids to hear the bad things that these people will be telling each other. You get it? So we remove one of the part. If there is a grandmother, the wife takes and goes for a holiday to the grandmother to stay there for some time. Then next, what do we do? This is the next step. Psychoeducation. Help the person understand what trauma is and normalize symptoms. You don't just start talking to the person. What do? You make this person understand that what you are undergoing is because of something that happened this time, and you don't know how to bring it out. You get it? We have removed a person from living alone or behaving in a such kind of a way. We have put this person at an environment that can lead to what? safety physically, and if there is children involved, we are protecting the children. Now, next, initial stage, you have not gone to the other stage. This is an early stage. Basic needs. Let the person get enough sleep, nutrition. If it's an adult, adult, we know how to go around them. We cannot just go to an adult to say this adult, no, this is the time that you need to know. Talk to this adult slowly by slowly. Let the adult know that this is your home, but now you cannot continue staying like this. Hmm? You get it? Yes, Gerono, I'm saying these are things that are happening, and by listening to them, you'll know how to handle these things out there. Hmm? Get sleep, nutrition, rest, and social support. This is a multitask. All the people involved should be there helping. We don't want broken marriages and life losses. Involve the society, the chiefs, the administration, the people should know there is something that is going on. Good sleep is related to one, high melatonin. Melatonin is a hormone that helps you to relax. The other one is serotonin. When the serotonin levels in your brain goes at a good level, you will relax and feel good. Serotonin. When you want pleasure, hmm, we talk about dopamine. You get it? So we are continuing by helping this person to relax, but not go to drink alcohol, even if it is a kid. These are the stages. Withdraw from traumatizing, life-threatening events. Help the person understand what you are undergoing right now is as a result of this that happened this time, and we want to help you. Hmm? And then there is ground techniques. Take when you are the person, the relative, or the doctor, or the psychiatrist, find a one person who can be taking this person out on a walk to distract the brain. Hmm? You see, mindfulness. You talk as when this person goes some places, this person forgets about what happened. If this husband goes some places, this person forgets some things. When this wife goes out of the house for a walk or talks with some people, forgets what happened. Yes, that is the initial stabilization stage, the early stage of it. Now we go to psychotherapy. We go to psychotherapy, evidence-based treatment, trauma-focused cognitive behavioral therapy. What do we do now here? Hmm? Reframe negative thoughts. How do you reframe negative thoughts? Like this cannot happen anymore. You met someone, you love the person, you have brought up a family, but now the family has broken down. Maybe someone has a person outside, the person is pregnant, or the other person, you have come with pregnancy. Hmm? Or a man has got a woman and thinks the wife is not the best. Or a post-stress disorder of a child after some traumas like child negligence or sexual abuse comes in turn in marriage. And once in a while, the husband becomes hard and shouts. But this child comes and says, it has happened again, I cannot stay here again. And you have stayed with this person for like 10 years. What happens? Psychotherapy. We have moved from the first stage. This is the second stage. Doreen Small, welcome to the platform. We are at the second stage of trauma management. Trauma management. You need to reframe the negative thoughts. As a counselor or a psychologist or a person who is helping, we have withdrawn this person from danger. Now it is time to help psychologically. Trauma-focused cognitive behavior therapy. Reframe negative thoughts. Turn the negative thoughts, try and turn the negative thoughts to positive thoughts. Give examples of how life can transition from something to a bigger thing that is good as they started, or as they tell this person whatever that is happening right now is an illusion. Don't look at an illusion. Look at what you started as a positive thing in future, so that you can thrive. You understand? Very important. That is like reframing. Give positive attributes. Don't go to a person who is injured and then you are giving negative attributes. Those ladies that like telling their friends now, leave that marriage. He's doing like that. Come and stay with me. Hmm? Men, a woman cannot do that to me. I'm a man. I can move on and get several women. You will never get a woman like the one you have. You'll never get the man like the one you've gone through a lot with. You get it? A child who has missed, a single person who has gone through stress, handling the mother who is sick or the father who is sick, now has given up. You reframe the negative thoughts and give positive thoughts, telling him you've tried and this is where you are and you are going somewhere. You try and handle this because we should make it in life. You don't give up. Help that person not to give up. Or if it is you, help yourself not to give up. You get it? Address avoidance behavior. We are dealing with psychotherapy. The first one was not psychotherapy. Initially, it was an initial stage for withdrawing from that environment. Now, the second one is addressing psychotherapy. Address avoidance behavior. The behavior of being alone and thinking deep. Someone might think things that are not correct. That's where suicide thoughts come in. That's where divorce thoughts come in. That's where you start thinking, I can kill this person because this person did this to me. You've seen so many relationships whereby people withdraw, then he goes back to kill someone. Avoidance behavior, staying alone. Hmm? Now, we go to used in both children and adults. This one is very important. If a child is avoiding, please get an aunt, a guardian, a person who is likes to stay. This person likes at least, so that he cannot be staying alone. He should be taken out. Avoidance behavior brings low serotonin and dopamine in the brain, and you start having negative thoughts. You'll not be happy. Hmm? So that being alone, when you have a problem and you want to stay alone, it is a negative sign. It's not a good sign. Stay around people and talk. Hmm? Eye movement desensitization and reprocessing. It is called EMDR, eye movement desensitization and reprocessing. Look at that person. Eye movement can help you know if this person is thinking. If you feel that this person sometimes is just the eye, there is no eye movement and the eyes are stable at a particular site here, and you are talking to this person, no, this person has withdrawn, is in the other world thinking about deep things that this person should not be thinking. That is where you want to interrupt always. Hmm? We are at the second step, psychotherapy. I'm training how to notice this person is deep in thoughts. Look at the EMDR, eye movement, decentralization, and reprocessing. This is what can make you know that this person is in deep thoughts, even if this person I'm with her or him talking, this person is not here. So look at the eye movement. How is this person relating to you as you talk? Is that person with you? Let this person open up. What are you thinking a lot around me? Hmm? Prolonged exposure therapy, eh, gradually confronts avoidance thoughts and situation in a safe way. Don't shout at this person and tell this person, stop staying alone. This is a kid, or this is your daughter who is an adult. Who told you staying alone will help you? Technically know how to help this person, because you don't induce trauma with trauma. Because if you induce trauma with trauma, someone becomes desperate and you may lose a life. You see? So technically know how to play around this person. Bring someone who can take this person out. You have seen daughters that have come out of marriage, they go to David. In which field are you specialized in? David, David, is David in the platform? Tell us, David. Now we are talking. You, you, you. We have seen daughters that have come out from a marriage. They go to their home. This happens in Africans a lot. Then the parents tell this person, "You should protect your marriage." Hmm? Oh, Sana, you are referring to me as David. I'm a physician, psychologist, and I'm working on cardiology. Thanks a lot. Yes. Now, when you're telling this person to go back to work on the marriage, are you helping? This is where trauma comes in now. This is where trauma gets in now. You don't shout. Be technical when you're dealing with a person with this problem. Person with traumatizing events carried out to adulthood, or acute traumatizing event that is currently happening. You might lose that person. We don't want to lose lives. We continue. Narrative exposure therapy, often used with refugees or survivors of complex trauma, involve reconstructive alive narrative to integrate trauma memories. Give an example of people who have come out successful after a trauma and they are bold and they can speak out. Hmm? Psychodynamic therapy. Psychodynamic therapy, exposure and conscious pattern and early life experience linked to traumas. Hmm? These are things you need to help this person with. Psychodynamic therapy, not you alone. I think we'll talk about palliative care, because palliative care is also part of trauma. Because you may see a person who has nursed a mother or a father or an uncle, and this trauma is carried up to adulthood. We were talking about emotional or psychological trauma. Now, there are some drugs that are used here, like we talked about serotonin reuptake inhibitors, selective ones like fluoxetine, used in PTSD, anxiety, and depression. You get it? And then we have valfacine. You know how they work. I explained how they work. They block the reuptake of breakdown, so the number of serotonin goes up and you feel relaxed. The anxiety goes down. These are not drugs that you can buy over the counter, unfortunately. When you go to your doctor, wherever you are, or you are a doctor, you want to give a patient, you should be very careful when you are prescribing them. You get it? Hmm? Help, self-help and lifestyle approaches are very important. Support groups, they help someone to know that I'm not alone. We are so many, so I should help myself, because help starts from the person. You are helping that person to help himself to come out of this. Yes, let's continue. If you have a question, we continue. Post it on the platform, we discuss it. We discuss it so that we know how to help. Exercise. Exercise is very important. Journaling, creative outlets that will distract you from what, and these ones will come when at our second stage when we are withdrawing. Hmm? When you are withdrawing in terms of management, you get it. The second step, yes, we continue like special consideration when it comes to traumas. Their special consideration. Children and adolescents need age appropriate therapy, family involvement. You see, children, when it comes to children, they need family involvement. And then we cannot overrule cultural sensitivity. Consider cultural beliefs, hmm, trauma definitions, and healing methods. We've seen sometimes back when uh, women's circumcision was being handled in some communities in Africa, where most of the people, women, prepared some centers where some ladies were taken. It's a very important thing when it came to handling of traumas. Psychologists and psychiatrists were taken to talk to these people and know how to handle them, because now this is a, a multitask. They have families that they have left behind. You want to be part of the family, but the family is one which is forcing you to do that. You see, this one needs a multitask. Hmm? You take people to talk to the family and talk to the child, because both of them are traumatized. Hmm? Complex trauma survivors, like war survivors. Hmm? This one is a very complex issue because these people needs to be treated, talk to the psychiatrist, and then they need integration to the society. So you see how these things interact. Hmm? These things interact. You should be very careful when handling a person with trauma. Now, we have talked about emotional trauma. If you have a question about emotional trauma, post it. Some people will help you, or I'll get it and then I'll try to handle. Let me answer. Yes, we continue. If you have a question, I'm answering one of you. Yes, like that. Now we 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 go talk about the other one. We had talked about the other topic that we have talked about. Now we go to the other one, which is secondary or vicious trauma. How do you handle secondary? I'll pick some topics because most of them are they kind like share the same management. Okay, we talk about developmental trauma. Hmm. This one's happens mostly. The generation that we are having nowadays is ruled by developmental traumas. The bringing up of a generation of the millennials was not like a generation right now. And many things are happening right now because of developmental trauma. So what do you think is developmental trauma? We go slowly here because generations are handled according to how the traumas of before are. Our children go to the street, they call Gen Zs, for demonstrations because of our own upbringing. Marriages are breaking out there. Family relationships are breaking. Sister brothers are fighting each other because of developmental traumas. So, what do we call developmental traumas? I'll repeat again. I think this topic is so wide. We may divide it into two. Yes, yes, Sana. It's interesting. Very okay. That is what I do. Now we continue. Refers to exposure, chronic, repeatedly, and early interpersonal trauma. Early, when you are a child, usually begins in childhood that occurs within the context of important relationships. And you know what important relationships are? Parents or caregivers. That is where the problem starts from. Hmm? Unlike a single traumatic event, developmental trauma disrupts the health, physiological, and neurological development of a child. See, it's very sad. Starts from early life and then grows up to adulthood. You see, common causes of developmental trauma may be one, physical, two, emotional, and then the third one, sexual abuse at child. In African country, the consent of age of sexual improvement is 18. So any person who involves him or herself with a child below 18 years, that is sexual abuse. There is no legality of a person of this age to tell you that I say yes, you will deal with the state. I don't know about the US, someone to tell us, and other states, because I'm sure we are people from around the world in this platform. So we may know that maybe in the US is 16, maybe another country is 21. Those are the ages variant. So neglect is another one. Domestic violence exposure is another one. Caregiver mental illness or substance abuse is another one. Frequent separation or loss of caregiver is another one. Institutionalization of foster care. Hmm? Institu- you foster cares. That is another one. You are forced to go to a foster care. Sometimes some children, their parents go berserk and then they are forced to go for foster care. This is a traumatizing event. Hmm? Witnessing violence or traumatic events repeatedly. This is a traumatizing event. You are witnessing the people you love fighting every time, calling and abusing themselves several words. You see, hmm? Now, how it differs from other traumas. This is how developmental traumas differ from other traumas. You'll find that the normal age, I'll give the age of where I am. I'm in Africa, Kenya, right now. I know we are some people here I can see from Jamaica, South Africa, US will give us your lane. Onset is from early childhood from 0 to 18 years here. Hmm? Usually adult or adolescent. Hmm. This one at the adult and adolescent is chance to post-traumatic stress disorders because it has happened, and when you get to adolescence, now it has become PTSD. Hmm. Now the type of trauma you have will always be chronic and sometimes interpersonal. You get it? Sometimes acute and often it may be accidental. Memory of trauma often fragmented or suppressed. You see, this is developmental trauma and PTSD. Hmm? We are differentiating how they are. Now, in developmental, you will get fragmented issues. I explained so much this one in details when we talked about PTSD, when it was single event, post-traumatic. You see, PTSD, you may undergo one single event that may lead you to have post-trauma, you to be post-traumatized. And then we have co-impact in developmental trauma, disrupted development, self-identity is impaired. Mm. And then we have fear and re-experience. You get it? And then there is a way we diagonized. I talked about how we diagonise PTSD when it comes to depression and the other things like anxiety. Mm. But in developmental trauma, you'll always have complex PTSD and attachment disorders, withdrawal from the social from the social environment and other people. Hmm? And you see, each of us has seen a child growing, and this child ends up to be an adult. What effect do these traumas have? Let's talk about the environment of harsh environment like of sexual abuse and sometimes domestic violence. This child may grow up being so rough, hmm? Sometimes not knowing how to handle personal relationship. You see, there are some things that we talk about and they come out so clear when we can help. But when you don't know what is happening or you don't know how you can diagnose a person who is undergoing PTSD or developmental trauma, you may neglect this person. So, developmental trauma affects every domain of childhood development, including the brain, body, and social skills. You see, because here you are supposed to handle a person, go to school, learn, but now the social skills are not being handled well. You go to school, you cannot learn well. See, how do we do it? These are the effects. Emotional developmental effects, difficulty in regulating emotions. These are the things you should look at when you are with this person who is displaying these issues. Difficulty in regulating emotions, you always have rage, fear, and sadness. You see, hmm? Fear, rage, and sadness. I know you've come across many. Ameacha kumwona tu. Okay, sawa. Haya. Excuse Dorothy. Dorothy. Now we continue. I'm asking her. Yeah. Now the mother has come. Okay, so I'm finishing up. Now we continue. Now, emotional, we have difficulty in regulating emotions. You cannot regulate emotions. When someone has hurt you, you shout, be aggressive, and destroy everything in your house. At times, you are so fearless. When something happens, you run away from home. Hmm? You see this? Total sadness. Sometimes you just sad. Emotional numbness or chronic distress. You are always distressful. Hmm? These are the things that happen when you have these problems. Emotional distress, low self-worth or shame. A child who has grown up with sexual abuse from a guardian or some people from childhood, this person will have emotional damage and he'll not have self-esteem because he'll be seeing he's not like the others or she's not like the others. Hmm? Trouble identifying or expressing feelings. You will have trouble of expressing your feelings always. You get it? Now, cognitive developmental, learning difficulties, poor memory and attention, impaired executive functioning. Impaired executive functioning, planning, decision making is poor. Hmm? Rigidity or black and white thinking. If you've decided this is it, there is nothing, no one can turn you to another thing, or one can convince you to do something else. You see, cognitive developmental issues, social developmental issues, trouble forming healthy relationships. I've talked about relationships when it comes to developmental. I started by that. Hmm? Distrust, withdrawals, or excessive clinginess on some matters. Excessive, you clinch on some matters, and you know those matters disrupt your relationship. Hmm? Social isolation and aggression. Isolation from other people because you are thinking they are not helping. Very important. Attachment issues, avoidant, anxious, or diagnosed attachment problems, fear of abandonment and intimacy problems. See, trouble feeling safe with others. If a person, a boy who has undergone traumas in early life because of the female sex, will always run away from them, even if in adulthood they mean good. This person will always be detaching from them. You see, at workplace, it becomes so hard for this person to work with the others. Now, we have behavioral symptoms. These are now the behavioral symptoms. Aggression or oppositional behavior, I've talked about it. Impulsivity, you work on impulse. Self-harm or suicidal behaviors. Substance abuse. Hmm? Somatic symptoms are like headaches and stomach. I said when I talk about somatic symptoms, you always know that we are talking about symptoms that are harming your body, symptoms that are coming out to harm your body. So when you have these problems, you'll have sleep disturbance, eating disorder, sometimes you withdraw or you eat a lot, dysregulation of nervous symptoms, hyperarousal or shutdown. Get it? And then we have long term. Those ones were acute. Long term consequences, if untreated, it ends up to be manic, depression, hmm? Depression, the major one, manic, anxiety, PTSD. Please, if you have not gone through the PTSD, you go through that video, listen to it very carefully. You'll understand what we are talking about right now. Bipolar problems, dissociations, hmm? Having relationship problems always, withdrawing from relationship here and there. These are the long-term problems that comes with these ones. Educational or occupational failures. You cannot work with people because yes, Sana. Uh, Memory loss can be genetic because of some issues. There are some people who are born genetically with some mutated genes that makes the basal ganglia of your brain, midbrain, below the basal ganglia, not to grow well. So the mutation, as you grow, we talked about the types of psychosis, and we saw how memory loss comes in. So yes, Sana, memory loss can be genetic because of some people are born with mutated genes that makes your brain atrophy. You see, we talked about Alzheimer's disease and the tau protein. So as your brain atrophies, the capability of memory goes down because now the serotonin and norepinephrine and even acetylcholine will not be at a normal level. So yes, Sana, it can be. Our previous lecture we talked about it. Listen, go through it so slowly, especially the one we talked about Alzheimer's disease. Alzheimer's disease, Parkinson's disease, it will you will understand well how memory loss can be genetically induced. There is a particular gene mutation that comes in. And then there was a person who made fun about the mad cow. Yes. Now that is a different one from the what we are talking about. We have talked about dementia. We talked about several types of dementia. Sana, to that lecture of dementia, you will come and see that memory loss can be genetic. It's very true, it can be genetic. Now, we are talking about long term consequences. We have said this person will have problems working with others, and then it will come to addiction of substance and alcohol. Most of the things here we are talking about we have discussed, because drugs and alcohol substance abuse, it's a long topic that we talked about some times ago. So as I'm online discussing with others, please, you when you have time, you go and listen to those. They will help you as you continue. Increased risk of health conditions like heart disease, diabetes due to toxic stress. We saw how depression can give you insulin resistance, leading to diabetes. And we saw how hypertension can come due to reduced neurotransmitters in your brain. So these are long-term consequences if this person that is has this problem can be left untreated. So we have gone through stages of approach of a person from these problems. So please, if you identify a person who has this, you have seen the first stage. If you are not understanding the stages of approach of a person who is undergoing trauma, you ask so that we repeat slowly by slowly. It is very important to know how to get a person from traumatizing event and to transition to a normal person. So many people right now are undergoing so many traumatizing events emotionally because of destroyed businesses, destroyed marriages, and so many things like this one that we're calling developmental traumas. A very bright person gets jobs instead of starting a family and doing good, creating resources and becoming something in the society. This person gets into drinking and substance abuse, or gets into abuse. A guy who went traumatized as a child, seeing the mother or the father being beaten by the other person, the spouse, gets a good job with a lot of money and ends up abusing the opposite sex, ends up in jail. That is a lost soul in the society. You see, so it's very important to identify these people and get in action before something bad happens. You get it? Now, management and treatment of developmental traumas, because these are traumas that have come from childhood. We may not go step by step as we saw in the other one. The core principles here we should see. First, like the other one, this is safety first. Physical, emotional, and rational. Mm? Physical means we should not let this person injure himself or get into diseases that may injure this person, like diabetes and hypertension. You see that. Secondly, relationship based healing occurs through safe, attunate connections. The parents, the relatives, the aunts, the friends, coming in and trying to help. One soul being lost is a lot of souls being lost. My sister daughter was about to go for open heart, but I will ask next time. I don't want to mix your agenda. No, you ask. You ask, I tell you right now, or if it is a long question, let me put this email here so that you can. Yeah. If it is a private or a confidential question, you can post it on that email. Very nice. That one. You see, a multitasking problem like developmental trauma, this is handled by a team, not a person, because this person has grown with this trauma for so long. So he needs to be handled by a team. And this team, especially the family, should be talked to identify the trauma and know how to handle it. And maybe even the guardians. mm, Trauma informed care, recognize the behavior, communication of unmet needs. The needs that this person needs should be communicated. And then we have something called evidence-based therapies, dyadic developmental psychotherapy, used for children with attachment traumas. You see, there are some children with attachment traumas because they underwent so much being neglected. mm, These children show very funny things when they are still children. This is the type of thing that we do. Dyadic development psychotherapy is a therapeutic approach designed to help children who has experienced significant trauma, neglect, or early attachment disruptions. It was developed by someone called Daniel Haas, mm, who is here we call Hayes. mm. You see, the primary goal of this help the child from secure attachment, especially with caregivers, promotes emotional regulations, trust and connect, connectedness, facilitates integration of traumatic experience in safe, related context, and it is for children. Children and adolescents with attachment disorder, complex traumas, reactive attachment disorders, emotional behavioral difficulties, and related to early traumas. This is for children. You see, now we continue here. Trauma focused cognitive behavioral therapy. Teaching coping skills. You see, you should teach a person how to cope from the trauma. Mm? You should teach a person how to cope from a trauma. Because now, if you help this person, you have withdrawn this person from marriage and giving him drugs, and this person has not helped himself or herself to cope from a trauma that is developmental. We will talk about how to cope from a trauma that is developmental. What will happen? This person may still go back and still have the same symptoms that this person started with. You see that? Which is you'll be doing nothing. mm, Often used in children. All these are often used in children like dynamic development therapy, mm, EMDR, eye movement desensitization reprocessing. We are always, when you're dealing with someone who is having trauma, always look at the eyes. Some people, they may go to a seizure while their eyes are open. But if you look at that person, the eyes are stagnant at a particular person. A person who is in deep thoughts, the eyes will not blink. You should Teach the caregiver or people around this person. If this person has 6 episodes of stagnant eyes, you will know that this person is still in deep thoughts. It's a negative sign. Hmm? 6 consecutive times, more than 30 minutes. These are diagnostic tools that the caregivers or the family members will tell you, and you know there is still a problem going on. A sane person will always blink the eyes like 30 times in a minute or more. When we talk about ophthalmology, we know that even 120 times in a minute. You see, then there is internal family system. Identify the parts of self, inner child, inner critique, and help the heal common and then help them heal. This one is the caregiver, the family plus you, helping you to identify the inner child, how this person grew up, how this person was. mm, Sensomonitor, psychotherapy, or symptomatic experience. Target body-based trauma responses. Help reconnect body and emotions. Sensory motor psychotherapy. They connect the body-based trauma responses. Physical body like acidity, headaches. Hmm? You see, help reconnect body and emotions. We don't want those bad symptoms. We want good symptoms. Always alert, talking to people, and doing everything as needed. Mm. We will still go to these children, these young children, and you will see they're still undergoing depression. So, what do we give these people that are still undergoing depression? If AD, attention deficit disorders, are noted, what do we do? Psychotherapy, serotonin inhibitors for depression and anxiety. You see, and then we have supportive intervention for children, stable nurturing caregivers relationship. Don't put these children near people that are toxic. Withdraw them from there. Give a routine of jobs to do or some work to do. Hmm? Take these people to schools that are trauma informed. They know how to handle children with trauma because not all schools will know how to handle trauma. You understand? Not all teachers are taught on trauma management. So identify a school where children are, the teachers or the people around are trained to this. Mm? Safe environment to express feelings. You know, when you talk things out, you relieve yourself. So don't take this where children are there to a school or an environment where children are there not to be heard but to listen. Take these children to an environment where they can talk out, be listened, and helped. Hmm? But if it is a person who is an adult, what do we do if it is a person who is an adult? Because developmental trauma can go up to adulthood. Long-term therapy, psychotherapy, very important. Building secure attachment in adult relationship. Positive people. Attach the person with positive people who can help this person have a transition. Very important. Support groups for trauma and survivors. Support groups, I know they are everywhere, but some countries, developing countries, this it's hard to find this, but you can identify, associate the person with some people who have formed the group. Self-compassion practice, e.g. mindfulness and journaling. You get it? Hmm? Train them for self-compassion. Hmm? And then there is the seventh step, which is recovering outlook. How do self-rebuild. This person to rebuild himself to be something else. Very important. Learning to feel. It's the general in the house. Big up, bro. Here it's in the evening. We are talking about traumas in life. And now we are at the developmental traumas. I hope you are good. The general, very fine. Nice. Let's continue. Regulating emotions effectively. These are things that are your targets to these people that are traumatized. Rebuilding self worth, one, learning to feel safe in relationships, because if someone is traumatized, it will be hard for this person to feel safe in a relationship. Mm? Regulating emotions effectively, yes. Mm? Processing traumatic memories and knowing how to handle them. You see, this is a person. mm, if a child is hyperactive, is it a sign of mental health? Sana has asked that. Hyperactivity in children may be normal, but you should take this child to a doctor to see if the child has a problem in attention deficit. There are some uh, complications in children that may come with attention deficit in children. Deficit. Most of them are normal because some children are normally hyperactive, but ADHD comes in, and this one we will talk about it mostly in children. It's something that has been programmed. Some people can confuse attention deficit and a normal child. Hmm? Attention deficit can be hyperactive or hypoactive. When I'm talking to hypoactive is when a child is not having a hyperactivity. Hmm? You see, it can be hypo or hyper. Hmm? We continue. I will. Uh, we have primary hyperactivity, which is ADHD, and others like autism spectrum disorder. You see, these are things like a doctor should categorize and diagnose. So, Sana, if the child is hyperactive but doing the normal chores normally, and you are not sensing something like the problems that we usually see, like bipolar disorders, the autism spectrum disorders, anxiety disorders, PTSD or sensory processing disorder, this child is normal. So you don't confuse the child having these other problems. But most of them, well, they are diagnosed in the hospital. Sometimes hyperactive kids are so bright. You may find they have a very high IQ normally. Yes, let's continue. I think I've tackled that. If a child has no other symptoms signifying autism disorder, bipolar disorder, anxiety disorder, PTSD, or sensory processing disorder, this child is normal. It's just that the child IQ is high and is always hyperactive. So mostly it happens to boys. Boys are hyperactive than girls. But if you see there is something that is not coming out okay or a symptom, it is good to take the child to a specialist or a psychologist to check if these spectrums are being signified in this, so that she can be managed. Now, we have talked about, I see that our time has gone and it's about to end. We have talked about developmental. We still have so many to cover up. We have just started on this topic. We are on developmental traumas. We have tackled two. We have still have 14. So we have a long way to go. And the topic of today, the most important thing we have talked about, recovery outlook. When you have gone all those steps that we have talked about, are rebuilding self-worth, learning to feel safe in relationships, because you see this is trauma and you are working on transition. That is the second one. Regulating emotions effectively. That is the third one. Processing traumatic memories and knowing how to handle them. That is very important. And then we have integrating fragment parts of self, integration and getting to transition. So as you manage this kid because or this adult because it's developmental trauma, those are your 5 intentions to this person. Very important. I think today I have had a lot of questions that I will not handle. Time has gone. Tomorrow we will continue with the others. Secondary, vicious. We have said we have several. We have acute trauma, chronic trauma, complex trauma, developmental trauma, secondary trauma, which is vicious, historical and integrated traumas, collective traumas, medical traumas, emotional and psychological trauma. That one we have covered. We have covered 2. And remember, we still have post traumatic stress disorder and risks that come with it. And we have to cover them. So if there is no any other questions that I've seen, uh, have a good time and be blessed, everyone. I'll answer those questions that have been sent and I'll tell my friends to help me answer from my email. Good time, be blessed, everyone.